part of it is when you have any medical condition or event, we have a tendency to not always hear everything that the doctors say or hear the different treatment plans. And so it allows that associate to have someone there to help support them. It gives them that opportunity to ensure that there's things that aren't missed, whether it's medication or, bandaging or whatever it is. But I think the biggest part is that support and having family support there, or a close friend with them as they travel.
That is Lisa Woods, Senior Director of U.S. Healthcare at Walmart. For the last decade, Lisa has been on a mission to redesign the healthcare experience for the nation's largest employer to ensure that every associate can live a balanced life. Innovative companies, including Walmart, are disrupting how they pay for care by taking insurers out of the equation and contracting directly with leading health systems. Walmart's Center of Excellence program changes lives by partnering with top specialists for serious medical conditions and procedures, giving employees easy access to the very best, most appropriate care possible. Walmart selects hospitals that have the expertise and resources to provide the highest quality care for a number of serious conditions. Treatment is often covered at 100%, including travel. This is Act 3. I'm Michael Sentz, founder of CaringWire and your host. On this episode, I'm going to make the case that caregiving affects all of us, no matter race, title, salary, or location. I am going to prove that to you with stories from the woman who is redefining healthcare at the largest self-insured company in the world. Along the way, we will discover why Walmart continues to prioritize investments in healthcare, how the program has evolved, and how to look beyond the data to holistically design a system that works. Okay, welcome to Act 3. I'm your host, Michael Sentz. And on this episode today, I'm absolutely thrilled to be joined by the Senior Director of U.S. Healthcare at Walmart, Lisa Woods. Lisa has established Walmart's Center of Excellence program, which changes lives by partnering with top specialists for certain serious medical conditions and procedures. And this innovative program gives Walmart employees easy access to the very best care and most appropriate care possible. So Lisa, thank you very much for joining me today. How are you doing?
Great. It's great to join you.
Yeah, absolutely. So I love starting off the show. We've talked before, but a lot of my audience doesn't know about you. So I call this the breadcrumbs, right? Tell me what you did in your personal and professional career in the past that got you here today.
It's interesting. So I've been fortunate enough to be able to be with this great company for 30 years, which I know is unusual, but it has been such a great experience. And Walmart has given me an opportunity to really drive change, to innovate. And so my career really has been, the whole time has been spent in benefits, working in every facet. And so, I think because of the experiences through the years, it's allowed me now to come to a point where I can drive innovation and change within the country.
Yeah, that's great. So 30 years at a company, relatively unheard of these days. What gets you up in the morning and really gets you excited to go into work?
I think, one, I work for a great company, right? And two, it's the opportunity to truly create change, especially in the healthcare environment, to know that we're impacting individuals, we're impacting families. That's what jazzes me and gets me up in the morning.
Absolutely. So one of the things that really strikes me about Walmart is the incredible stories around the legacy of Sam Walton and how one store turned into this massive empire. And as I was preparing for this interview, it really kind of perpetuated that thread, right? All great change comes from amazing stories. And I read one little nugget, and I'm hoping you can confirm this, that resonated with me, that this whole journey, the aha moment of the Center of Excellence, really started with Sam Walton making a proclamation. Can you unpack that for us?
I think what you're referring to is there was a time where Sam Walton, really was focused and thinking about how healthcare was delivered and the costs, the impact to, associates. And he shared his thoughts with us. And so I think that's what you're talking about and referring to. And so it is something that we, it's really within the thread of everything we think about. The associate is always at the center of everything that we're thinking about, what we're building, and it really doesn't matter what it is here at the company. And so he was interested in healthcare, along with obviously retail and everything else. But that is clearly a key to what helps drive us in everything that we do.
Yeah. And so as we kind of transition to what is the COE, obviously people can go online and check it out. Super cool, very innovative. But can you talk about how it's iterated over the last number of years, where you started and where you are today?
Yeah, happy to do that. We started in 2012. And we were looking at our data and we started realizing that there was truly differences in how care was delivered in the country. And there was truly differences in cost, right? And so as we thought about what we could do to try and ensure that our associates got the best care, we decided to focus on spine and heart. Those two conditions have very clear evidence-based protocols in place. And they were two conditions where we felt we could travel associates. And so in 2013, we started and we implemented spine and heart. We then expanded that to hip and knee replacements in 2014. In 2015, we then implemented cancer, and it was breast, lung, and colorectal cancer that we focused on. And that program's a little different in the respect that we send all the medical records and the oncology slides and information to our centers of excellence. And it's in an effort to really ensure that we don't have associates that travel unnecessarily. You don't want associates that are sick with cancer to travel if they don't need to. And so that program has been very successful in partnership with Mayo Clinic. In 2016, we expanded to cover weight loss surgeries at our centers of excellence. And in 2017, when we were looking at the data, we started to really realize that we had a lot of associates that didn't need surgery related to spine. And we started hearing that when associates went to the centers of excellence and they were told they needed surgery in their home communities, that surgery wasn't necessary, that there was an alternative. So we changed our plan design to say, because we've always paid 100% at centers of excellence, we changed our plan design to say, we're strongly encouraging you to go to a centers of excellence. However, you can stay in your home community, but it will be payable at 50%.
Right.
In 2018, we did the same thing for hip and knees because we were seeing the same result on hip and knees. And in 2019, we changed our plan design again. And for spine, we decided to require our associates to go to a centers of excellence. And the reason why is because we were seeing that about 54% of our associates did not need surgery. And there was an alternative treatment, whether it's physical therapy or injections. And so we felt like we honestly had a responsibility at this point. Now, we want our associates to have surgery when they need it, but not unnecessarily. And then just one more point, in 2019, we added prostate cancer as well as blood cancers to our Centers of Excellence program.
So the point you made about encouraging the associates to utilize the Center of Excellence, to me, that's core to what Walmart promises, right? It's everyday low prices.
Right.
It's everyday low prices as long as you go to the best possible thing for you and in your condition. And this is no different. It's 100% paid as long as they utilize the COE services. Is that correct?
It's true. That's true. And I think it's important to note, and I had an opportunity to co-author an article in the Harvard Business Review. And one of the things that we talk about is this has always been about quality. It's always been about ensuring that our associates get the very best possible care. It's never been about costs. And what you'll see in that article and what we share is that we actually pay more for surgery at these centers on average if an associate needs surgery. And that's okay. Because we do see downstream savings because they are getting the best quality.
And so that's really interesting to me. So the impact that it has is astounding, right? The qualitative feedback that I read in that article is I never realized healthcare could look like this, right? You're completely redesigning the entire experience. But then the quantitative impact is patients returning to work sooner, sometimes 3 weeks or 20%.
Right.
50% reduction in surgical procedures. Just insane cost and quality impact. But then you go on to talk about the halo effect. So this is something that was really interesting to me because you are paying more and your Walmart is contracting directly with these medical facilities, these clinics, right, that are best in class. And typically it's at a lower cost to them or a lower price to them. And yet they get this halo effect. So can you talk about what that means and these kind of secondary impacts to the whole community?
I think what's so fascinating in all of this, the hope is that we're improving care in all communities. It's interesting to watch, these really great health systems coming together. We actually have these summits on an annual basis where these healthcare systems come together and they talk about best practices. They are sharing what works and what doesn't work. And so really never expected to see that happen. And then the opportunity for the Centers of Excellence to reach out into the communities and connect with the physicians within the communities and talk to them about care. That's some of the halo effect that we see that, we really didn't see that to begin with, right? It wasn't something that we expected as we started this whole program. It was all about the associate and taking care of the associate.
Now, when you evaluated the cost drivers to pinpoint in exactly what the entry point and the introduction to Center of Excellence would be, starting with spine and heart, it was the highest tangible costs that had other qualifying factors. But as we now know, the social determinants of health and the lifestyle people live drive a significant portion to health cost and quality of life, and therefore driving up the overall cost of health in general. As somebody who is paying attention to all aspects of this and looking at, how to really redesign that healthcare program, how do you think about implementing the necessary tools to affect real change here? And are the social determinants something that you're paying attention to?
We do pay attention to that. Part of, the genesis of this program, getting back to we pay 100%, right, for our associates. We pay for all of their travel, their, hotel needs, their meals, etc. I think that falls in line with a lot of what you're highlighting and outlining. And our goal is to ensure that our associates can get that care, right? And there is not a barrier And it goes back to getting, making sure that they get the best care.
You also had talked about in a previous interview the slow uptake, and that partly being attributed to travel. And the message is coming through. We pay 100% of travel, and we include that caregiver that is critical to decisions in this process, both in planning, making decisions, and then actually executing the care itself. In my situation, the reason why I got in this field in general is I saw my mother, who was the primary caregiver for her parents, my grandparents, struggle. And traditionally, she was left out of a lot of these conversations, right? And yet she had the authority and the power and the influence to make the my grandparents do what they needed to actually do to get better, or at least to maintain a good quality of life.
Right.
Can you talk about what is that role of the caregiver, how you look at it, and how did that insight get uncovered?
Yeah, so it's really interesting. A couple things that I think about there. When we developed this program back in 2012, one of the things that we were adamant about is ensuring that a caregiver went along with our associate. Part of it is when you have any medical condition or event, we have a tendency to not always hear everything that the doctors say or hear, the different treatment plans. And so it allows that associate to have someone there to help support them. It gives them that opportunity to ensure that there's things that aren't missed, whether it's medication or, bandaging or whatever it is. But I think the biggest part is that support and having family support there, or a close friend with them as they travel. Because like you mentioned, some of these associates, may have angst about traveling. And we talk through that with them. And I think having a caregiver is so important. The other piece I would mention is the other part of this program is ensuring that we have a navigator at the centers of excellence that meets the patient as well as the caregiver. And that navigator is there, honestly, to support both of them, but they are there to help support the caregiver as well. That navigator takes them to appointments, helps answer their questions. They're really the expert in helping them, acclimate to the centers of excellence. And that's been a very powerful part of this program.
Now, here's something that I just want your opinion on. The navigator, I can envision what that looks like. Almost you come to a hotel and it's the concierge saying the pool's over here, the workout facility's here, here's where you get breakfast. In healthcare, is it necessary to have a human-to-human connection with that navigation piece, or can it be done utilizing technology as we've seen in other industries like travel?
Right. So I think when it comes to healthcare and conditions, serious conditions, I think that human touch is really important. In saying that, though, I also see the future where telehealth will become increasingly more important just to provide access to care. And honestly, there are some individuals that are more comfortable, talking to a doctor or seeing a doctor through the telehealth mechanisms. Certainly, we're not to a point, where the complexity of a heart surgery, right, can't be done through telehealth, but certainly follow-up, right? So after surgery, what opportunities are there in follow-up care? I think there are some really exciting advances that can come and will come in the future, related to that.
Now, balance is a topic that comes up all the time on this show. And, working for a large corporation for 30 years, your time is pulled in a million different ways, right? And you also have your own life to tend to. Can you talk to somebody who might be recently find themselves as a caregiver, and give some advice, or how do you talk to your associates or your coworkers about when they are dealing with something that requires so much mental, emotional, physical energy? How do you balance it all?
Yeah, it's a great question. I've had aging parents myself. I have children, so I am, I've myself managed through this. I am fortunate enough to work for a company that is willing to work with each individual. So keep in mind, we have 1.5 million associates in the U.S. We all walk a different life and have different scenarios and situations. And the company has been very good to work with associates when they have these family situations that occur to try and maintain and keep that balance. We're fortunate enough too to have, a good PTO benefit, and we also have maternity benefits that have been expanded in the last year, and adoption benefits. So there's a lot of things that the company has tried to do over the last, several years to improve the benefits and to allow our associates that balance.
Now, as obviously CaringWire is focused on helping with that balance. As an employer, when you're reviewing the data and understanding the impact that healthcare and caregiving has on your associates, does it pop up in particular data points, whether it be absenteeism or claims data? Is there a particular focus that signal might become more obvious to people who are evaluating this as a need?
Yeah, so I haven't seen in the data that I've looked at those things, pop up. Now, whether that's attributed to the fact that we're managing and trying to support our associates where we can, but when I truly look at, whether it's claims data or other pieces of data, I don't see that, popping up in the data at this point.
So it's still a silent killer.
It is. Well, it's, there are always, when you look at data, there's always things that may not appear right and be very evident. So
now, when I look at Walmart, it's one of, if not the largest, it's one of the largest self-insured companies.
Mm-hmm.
Right? And so 1.5 million U.S. associates, from executive level down to kind of the blue collar workers that are doing the day to day, which gives you incredible data advantage over a lot of the other players, not to mention the hundreds of millions of shoppers that go to the store and get their daily goods there. That data is powerful. Right. And the CEO, Doug McMillon, publicly stated that healthcare now represents one of the company's two most significant areas of innovation. That has to feel good for you. Can you go into...
it's exciting for us.
Yeah. Can you go into what that looks like and how Walmart is utilizing this insight into the U.S. population and how they're viewing themselves as, where do they sit in this ecosystem from a healthcare standpoint?
Yeah, so I'm probably not the very best person to talk about the whole Walmart ecosystem from a healthcare perspective. What I can talk to you about is from a plan perspective and the benefits that we offer to our associates. And we restrict ourselves to that data, right? Just the plan data, the what we see in medical claims versus disability. We are obviously focused on looking at that information, and we continue to look for ways. And how do we take these key learnings from our centers of excellence? And how do we take, you mentioned earlier, how do we take this comment about, I didn't know that healthcare could look like that? And how do I ensure, or how can you help us figure out, where does that healthcare exists in our communities. That is what we're focusing on. That's what we're thinking about, is how do we get our associates the best care in their communities and continue on this journey with the centers of excellence and focused on quality.
Yeah. Now wrapping up here, because I know that we're getting short on time, there is this focus on communities, right? And centers of excellence, traditionally the best surgical centers or treatment centers in the world that you have access to. And yet there's a strong desire for associates to stay in their communities, not leave home, their support systems here, whatever it might be. How do you evaluate that and connect the people who want to be in their community to the appropriate resources to augment their needs?
Yeah, so great question. I think the best way to frame this up is we have the centers of excellence. We talk our associates through that. And quite honestly, we're still working on how do we help our associates get to the right resources within the communities, so that maybe there isn't this need to travel in the future, potentially, right? You can't travel everything. You can't travel, someone that has a broken leg. That doesn't make sense. But you also want to make sure that your associates go to the best orthopedic doctor, right? So it's something that we are thinking about every day. And how do we make that happen? So I'll leave it at that.
Yeah, I love it. Well, Lisa, I really appreciate you coming on today. I could literally go on all day and questions, but unfortunately our time has come to an end. So tell us where we can go to find out more about you and your work with Walmart Center of Excellence.
Yeah, so I think online, obviously, you can put in Lisa Woods and all kinds of things come up. But I think the best place to really learn about centers of excellence is the Harvard Business Review article that I had an opportunity to co-author with Ruth Coleman and John Slotkin out of Geisinger. And it was released this year in March. I think that's probably the best place to get information.
And I will put a link to that in the show notes. So
great. Thank you.
That I'll make it very easy to access. I want to thank you to my guest, Lisa Woods. My name is Michael Sentz. Thank you for joining us, and we'll see you next time.
Thank you.